Dear Bodhomayananda, I am very glad that you have planned a national level seminar on the role of Ramakrishna Mission in the healthcare in India as part of the 125th anniversary celebrations of the Ramakrishna Mission to be held on 1st July 2023. You have also requested for a video message from me suitable to the occasion. I gladly do so. While founding the Ramakrishna Mission on 1st May 1897, Swami Vivekananda underscored its object as propagation of the principles propounded by Sri Ramakrishna and illustrated by his own life for the benefit of humanity and to help humankind in the practical application of those principles in meeting their spiritual, intellectual, and physical needs. The period between 1870 and 1920 has been called the Age of Famines and Epidemics in British India. Epidemics of plague, cholera, and influenza, along with rampant malaria and tuberculosis, claimed well over 30 million lives during this period. 10 million people were estimated to have died in the two famines only between 1896 and 1899 alone. The death rate in India during this period hovered between 40 and 50 per thousand, nearly equaling the birth rate, and the average lifespan of an Indian was only 20 years. Given this situation, attending to the physical needs of the masses was the urgent task before the Ramakrishna Mission, and this it did promptly and efficiently. Within 3 months of starting the Ramakrishna Mission in 1897, Swami Vivekananda was writing to an American acquaintance, I quote, "Only one idea was burning in my brain to stir the machine for elevating the Indian masses, and that I have succeeded in doing to a certain extent. It would have made your heart glad to see how my boys are working in the midst of famine and disease and misery, nursing by the mat bed of the cholera-stricken pariah and feeding the starving Chandala, and the Lord sends help to me and to them all." Unquote. These emergency relief measures soon evolved into permanent centers of service, attending to indigent, helpless, profoundly ill, and undernourished men and women, widows and orphans, among the others. These centers, the most important of which were at Varanasi, Shargachi, Konkal, and Vrindavan, were termed Sevasramas or homes of service, and have had a distinguished history of service spanning nearly 125 years. Each of these centers has been run by men and women who served with singular dedication to bring the best available comprehensive care to the most needy in a spirit that is best termed worship. This history makes for instructive and inspiring reading that all youth involved in or aspiring to serve in the health sector can peruse with profit. As the Ramakrishna Mission activities continue to grow and spread in the early decades of the 20th century, its monastics and workers kept on stepping forward to attend to the health and other needs as per local requirements. Thus, working in the remote Khasi Hills in Meghalaya in the 1920s, Swami Prabhananda, more popularly known as Ketoki Maharaj, introduced homeopathic and biochemic medicines to manage diseases in areas where doctors found it difficult to come by, and also improved methods of potato cultivation to augment the nutritional and economic needs of the tribal population. The maternity and child care hospital, Ramakrishna Mission Shishu Mangal, was started in Kolkata, then Calcutta, in 1932 to bring the latest care to this most needy group, and has since grown into a multi-specialty hospital and postgraduate medical institute. The TB clinic started at Delhi in 1933 was the first of its kind in the national capital and one of the first in India to provide non-sanatorium based care for tuberculosis patients in the pre-antibiotic era. Later, a TB sanatorium was started at Ranchi in response to high prevalence of this disease among local tribals. In 1979, a general hospital, the first of its kind in Arunachal Pradesh, was started at Itanagar at the instance of the Government of India, and in 1985, a comprehensive health care, educational and socio-economic uplift program was initiated for the tribal population of Bastar at the request of the Madhya Pradesh government. These centers have been at the focus of the growth and development of the people of these areas. Presently, the medical service of the Ramakrishna Math and Mission caters to over 55 lakhs patients annually through 14 hospitals, 131 dispensaries and polyclinics, 87 mobile medical units and over 700 medical camps, incurring an annual expenditure of over 335 crores. These statistics do not include the health and education and health promotion activities that form an integral part of its formal and non-formal educational as well as tribal and rural development services. As part of Swami Vivekananda's 150th birth anniversary celebration in 2013 to 2014, the Ramakrishna Mission launched the Gadadhara Budaya Prakalpa, an integrated child development project, and the Vivekananda Shastha Seva Prakalpa, a rural maternal and child health care project across the country. The Ramakrishna Mission has been a pioneer in implementation of mass rural sanitation and waste management programs and has carried out numerous sanitary activities, including mass construction of household toilets and sanitary facilities, solid and liquid waste management programs, sanitary drives, and awareness generation campaigns. It also played an important role in the national COVID-19 response through relief measures, COVID care work, and vaccination drives. The mission also has a long history of supporting and facilitating traditional and alternate medical and health promotion measures. Swami Vivekananda's pioneering work in generating global awareness about the various yogas as spiritual disciplines has subsequently resulted also in the massive global interest in yoga as a health promotion measure. Most of the centers of the mission have used homeopathic treatment as both efficacious and cost-effective therapy. Ayurveda, Siddha, and naturopathy are also supported by several of our centers. Mobile medical units and medical camps are widely run to reach out to unreached populations. Moreover, telemedicine services are also provided in select centers for the rural populace. Health awareness and health promotion form an important part of the mission's health services, and it has developed considerable educational material for this purpose. Ramakrishna Mission invites all involved in medical and health care, as well as those aspiring to do so, to participate in and support the diverse healthcare activities of Seva Yajna. Swami Vivekananda has pointed out that, I quote, "There is no greater dharma than this service of living beings. If this dharma can be practiced in the real spirit, then liberation comes as a fruit on the very palm of one's hand." Unquote. In serving humanity through the Ramakrishna Mission, we can all aspire to this highest spiritual fulfillment, even as we function as instruments for building up a holistic, healthy India as envisioned by Swami Vivekananda. May the blessings of Swamiji Maharaj shower profusely on all present here today. I wish the seminar all success. I pray to Swami Vivekananda, the General of the Militia, to which I am a humble soldier. Sarve Sukhino Bhavantu, Sarve Santu Niramayaha, Sarve Bhadrani Pashyantu, Ma Koschit Dukama Apnuvat. Let all be happy. Let all be free from ailments. Let all be blessed with the vision of truth, beauty and goodness. Let misery touch none. Thank you so very much. Before I take leave of you, I must thank profusely my brother Swami Bodhomayananda, the head of our center at Hyderabad, who has so kindly remembered me for this great occasion. Thank you again.